In a woman's intimate life, there may come moments when desire fades, the body no longer responds as it once did, or silent pain creates hesitation with each intimate encounter. These experiences are not unusual or shameful. In fact, they may be signs of a medical condition known as Female Sexual Dysfunction, or FSD. FSD is a medical term that refers to a group of conditions affecting a woman's sexual function, including low desire, difficulty with arousal, trouble achieving orgasm, or pain during intercourse. To be diagnosed as FSD, these issues must last for at least 6 months and cause significant distress or negative impact on a woman's quality of life. In modern society, topics related to sexuality, especially women's sexuality, are often wrapped in discomfort and cultural taboo. As a result, many women suffer in silence, believing their experiences are a personal flaw or something to get over. Yet, according to medical research, nearly half of all adult women experience some form of sexual dysfunction during their lifetime. This is not rare. It is a common health concern that deserves proper understanding and support. Importantly, FSD is not simply a lack of interest in sex. It is a broad spectrum of symptoms. Some women completely lose sexual desire. Others feel the desire but cannot physically respond, experiencing a lack of natural lubrication or arousal. Some struggle to achieve orgasm no matter how hard they try, while others endure physical pain, burning, or vaginal spasms during sex. All of these experiences can deeply affect emotional well-being, self-esteem, and intimate relationships. What makes FSD complex is that it doesn't stem from a single organ or cause. Sexual function is an interplay of physical health, mental state, and emotional connection. Therefore, any disruption to hormones, the nervous system, psychological health, or personal relationships can lead to dysfunction. For example, low estrogen after menopause can lead to vaginal dryness and discomfort. Chronic stress or depression can suppress sexual desire. Medications such as antidepressants, blood pressure drugs, or even birth control pills can interrupt sexual function. Despite these well-known factors, FSD often goes undiagnosed in clinical settings. Many women are too embarrassed to bring it up, and many healthcare providers hesitate to ask. As a result, countless women quietly carry confusion, frustration, and the feeling that something is wrong with them, when in reality, help is available and effective treatment exists. Understanding FSD is the first crucial step in breaking this silence. With the right approach, psychological counseling, hormonal support, lifestyle changes, and improved emotional communication, women can regain confidence and reclaim fulfillment. Raising awareness about FSD not only empowers individuals to better understand their own bodies, but also contributes to building a more compassionate and informed society that values women's sexual health. FSD is not something to be ashamed of. It is a valid and treatable part of a woman's overall health. It deserves to be acknowledged, addressed, and healed. And most importantly, you are not alone. Countless women have experienced the same struggles, and many have reclaimed their intimacy, their confidence, and their joy, simply by speaking up and seeking support. Although rarely discussed in everyday life, female sexual dysfunction, FSD, is surprisingly common. Large-scale studies in the U.S. and other developed countries have revealed that up to 40 to 50% of adult women have experienced at least one form of sexual dysfunction in their lifetime. This is not a small number, and certainly not a minority issue as many might assume. The unfortunate truth is that despite its high prevalence, most women still suffer in silence. This silence stems from many factors: cultural taboos around discussing sexuality, the belief that it's a private matter, or the misconception that it's simply part of aging. Some women even blame themselves, thinking their condition is a sign of coldness, lack of love, or unwillingness to please their partner. But medical science tells a different story. FSD is a real health condition with biological, psychological, and social roots. It has nothing to do with morality, love, or dedication. In fact, many women who love their partners deeply and live healthy lifestyles still struggle with FSD, whether due to hormonal imbalances, side effects of medication, chronic stress, or unresolved emotional trauma. Women in their perimenopausal and menopausal years, typically 40 and above, are at the highest risk. Hormonal shifts, especially drops in estrogen and testosterone, can significantly affect sexual desire, vaginal lubrication, the ability to achieve orgasm, and overall physical response. Moreover, women after childbirth, caring for young children, or those in strained relationships are also more vulnerable to FSD due to psychological stress and emotional fatigue. Another crucial point: FSD is not just a condition affecting older women. Recent studies have shown that young women in their 20s and 30s are increasingly experiencing sexual dysfunction as well. The primary causes include work-related stress, anxiety, depression, lack of comprehensive sex education, and unrealistic expectations shaped by social media and pornography. Despite this widespread reality, surveys by the International Society for the Study of Women's Sexual Health, ISSHS, indicate that fewer than 15% of women experiencing sexual issues seek medical advice or counseling. This gap points to a major shortfall in women's healthcare, not just on the patient side, but also within the medical system and broader society. FSD, therefore, is a widespread yet overlooked condition. Millions of women are living with what has become a normalized dysfunction, assuming that it's simply a natural part of aging, marriage, or being female. But that is far from the truth. Sexuality is a part of overall well-being, and any issue that affects joy, connection, and freedom and intimacy deserves to be acknowledged, diagnosed, and treated. Understanding the prevalence and reality of FSD is the first step toward breaking the silence. It serves as a reminder that you are not alone, and you don't have to keep enduring it. It's time society opens up to women's sexual health, not merely for the sake of physical intimacy, but for the happiness, wholeness, and mental health of millions of women around the world. When people talk about sexual dysfunction in women, they often immediately think of losing interest or not wanting intimacy anymore. However, the reality is far more complex. FSD, female sexual dysfunction, is not simply about reduced desire. It is a broad spectrum of physiological and psychological disorders that affect every stage of a woman's sexual cycle, from inner desire, physical arousal, orgasm, to emotional satisfaction afterward. In modern medical classification, FSD is divided into four main categories. 1. Hypoactive sexual desire disorder, when a woman has little or no interest in sexual activity, not due to temporary fatigue, illness, or another identifiable cause. 2. Sexual arousal disorder, when a woman may have the mental desire, but her body fails to respond. No physical excitement, lack of vaginal lubrication, or absence of physiological signs of arousal. 3. Orgasm disorder, the woman has difficulty reaching orgasm or is unable to do so despite adequate stimulation and desire. And 4. Genital pelvic pain/penetration disorder, involving pain, burning sensations, or involuntary vaginal muscle contractions during intercourse, making the experience distressing or even intolerable. These types of dysfunction rarely occur in isolation. They often overlap, interact, and create a cycle of negative emotions. A woman might initially experience physical pain or dryness during intercourse, which leads to fear or avoidance of sex. Over time, this can decrease her desire. Conversely, long-term stress, anxiety, or relationship strain can first reduce desire, which then leads to arousal difficulties or orgasmic issues. This is why assessing FSD requires more than just asking, "Do you still have sexual desire?" A specialist must consider multiple dimensions: emotional state, physical health, hormonal balance, relationship quality, and even past sexual experiences to truly understand the root of the problem. Oversimplifying FSD as simply a lack of interest not only misrepresents the condition, but also places guilt or shame on women who are suffering. In reality, what they need is understanding, support, and access to medical care, not judgment or blame. FSD is a component of sexual health, and according to the World Health Organization, WHO, sexual health is an essential part of overall well-being. A healthy woman is not just someone free from illness, but someone who can feel, share, and enjoy intimate connection without pain, fear, or shame. Understanding that FSD is not just about losing interest, but rather a complex, layered experience is the first step toward healing, with knowledge, compassion, and meaningful action. In the minds of many, female sexual dysfunction, FSD, is often confined to the realm of marital issues or bedroom matters. However, this perception is overly simplistic and even misleading. In reality, FSD is a comprehensive medical issue that involves multiple systems in the body and reflects the woman's overall physical, emotional, and mental health. Sexuality is not merely an instinctual behavior. It is a complex interplay of biological, neurological, hormonal, and psychological processes. For a woman to fully experience desire, arousal, and pleasure, her body must function in harmony. Hormones must be balanced. The nervous system must respond appropriately. Blood circulation must be healthy. The mind must be relaxed. And the emotional environment must feel safe and trusting. When even one of these elements is disrupted, such as estrogen imbalance, chronic stress, depression, or chronic illnesses like diabetes, hypertension, or joint pain, sexual function can be significantly impaired. Beyond that, factors like fatigue, sleep deprivation, anxiety, or strained relationships can lead to a complete loss of desire, physical non-responsiveness, or even pain during intimacy. That's why FSD cannot be treated simply with romantic gestures or bedroom tricks. It must be recognized as a legitimate medical condition that requires thorough evaluation, accurate diagnosis, and a multifaceted treatment approach. A medical professional addressing FSD doesn't just ask about sexual activity. They explore menstrual cycles, hormonal profiles, current medications, underlying health conditions, mental health status, and relationship dynamics. It's important to emphasize this. Sexual health is a vital part of overall health, just like nutrition, sleep, or breathing. When a woman's sexual well-being is disrupted, it's not just a minor issue or something that will go away on its own. It is a warning signal from the body, indicating that something deeper may be out of balance and in need of healing. FSD is also not just a woman's personal issue. It can affect relationships, marital harmony, self-esteem, and a woman's freedom to express her identity. Ignoring it means neglecting a part of her dignity, her vitality, and her right to live fully and healthily. It's time we shift our perspective. FSD should no longer be seen as a shameful or private bedroom issue. It must be acknowledged as an essential part of women's health. Understanding, listening, and treating it with care doesn't just restore sexual function. It helps women reconnect with themselves, their emotions, their joy, and their sense of self-worth. Female sexual dysfunction, FSD, is not just about low desire, as many people assume. It is a complex and multi-dimensional medical condition that affects every aspect of a woman's sexual experience, from internal desire, physical arousal, and ability to reach orgasm, to emotional satisfaction and a sense of connection with herself and her partner. FSD can arise from various causes: hormonal imbalances, chronic illnesses, medication side effects, psychological trauma, or relationship stress. It is not a woman's fault, nor is it simply a normal part of aging. Rather, FSD is a signal from the body and mind, indicating that something deeper is calling out for care, understanding, and healing. Sadly, millions of women continue to suffer in silence due to shame, social stigma, or simply because they don't know that this condition can be diagnosed and treated. Sexuality is a vital part of overall health, not a luxury, but a right to live fully, freely, and joyfully. That's why it's time to break the silence. Understanding FSD is the first step toward giving women back the power to love, not just to love others, but to love themselves. And when a woman is truly heard and healed, she doesn't just reclaim pleasure, she rediscovers her confidence, her connection, and her control over her life.